Okay, I sent you an agenda earlier, and then today I sent you just a couple of backup papers. I want to move I'm going to move the review of the financial memorandum up just because all the rest of the agenda really is connected. So we'll just get that out of the way. The only thing to point out on there, we have all well, there's a pretty sizable donation for the backpack program, and they're very good about donating every year to the backpack program. But all the UPK contracts are on there. The only thing that you should note on there, we did send them a letter that said, we had the 20% withheld. We did pay them in full last year, but this year we sent them a letter with the contract and with the payments that said, basically, this is what we owe you, but we're going to pay you what the state funnels through us. So as soon as they make us whole, then we'll make them whole also. So that was the only change there, and they were all made aware of that very early on, because we did pay it last year and we still have not received it back. So that's the only change on there, and they're all aware of it. The good thing about the UPK grant this year is that, and it's just a one-year thing because of how crazy things are, but we used to have to base it on whatever enrollment they had on Beds Day. Now they're allowing us to do 3 different enrollment dates, and one is not even here yet. So if more kids come, if things open up and more kids go in, we can pay them for the whole year for those kids. So in that way, they might be making some of the money back, that they're losing. So that was I thought a good thing that the state did for them, because the kids are in and out, based on the COVID situation. So it wasn't really fair to them to hold them, to cap them, when it was the middle of the crisis. So anyway, they might be getting more money. That's the only thing on there that I think I wanted to point out to you, was that the change in the agreement. So the health insurance update, I tried to send these papers in order to you. All I did was plugged in our actual, we did get the actual rates for Broome Tioga for our current plan. So I plugged those numbers in, and then I plugged in the case BP numbers, and it's not official, so we can't put it out there until February 11th, but case BP is going to be a 0% increase. So it's unofficial, but it will be a 0. So I just plugged that in, and for comparison purposes, you can see that.
When did you send that to us?
Oh, it wasn't that long ago. It was maybe an hour and a half ago.
Got the agenda at 3.
It was today. There were 4 PDFs.
Was it after you sent the agenda?
I sent the agenda the other day. So
I got mine at 2:03. But
yeah, 2:03 p.m.
Yeah.
The agenda?
No.
The backup.
Okay.
But usually at least 2 of you are responding to emails I haven't even received yet. For whatever reason, that's norm. So, it may have come to others before that.
I found it. Thank you.
Okay. And you have yours, Jamie? Yes, you said you got it.
Yeah.
So if you just look at that, I just tried to plug in the actual numbers because I know when we were working before, we were using some estimates. So this is even without changing any of the retiree things, which is where our real savings would be, without doing anything and leaving everything status quo, just switching over to case BP would save us $366,000. Ironically, that's our increase right now in the budget. So, so anyway, we could hold the line if we went to case BP, and then any change that we made to retirees would actually would be a savings. It would be a a reduction in our budget in that line item. So, what we haven't heard a lot about it, I don't think. And the questions that we had, we were able to answer. I really haven't had a lot of questions. I know one of the units said, we looked it over and it's not better and we're not interested. So then, Tom said, why don't you go back to them and find out what their actual questions were? So we did. And what I found out from that was that they were misinformed or things were miscommunicated. So what they thought wasn't covered actually was. And they were thinking that Case BP was allowed to change it all year, that it wasn't a fixed rate. And that was a misunderstanding, because all I was saying was they don't have their rate fixed right now, but we project that it will be 2% or less. So anyway, I think we clarified all that, and I haven't heard a thing since then. And I don't know if you've heard anything, Tom, but
No, Lisa, I haven't, but I appreciate you sending all of those answers along to them.
yeah, I think they clarify a lot of things, that people were kind of digging their heels in and saying, well, we can't change because it doesn't cover this, or it doesn't cover pre-existing conditions, it doesn't cover supplies, and it actually does.
Yeah.
And I think they were just they were being misinformed by other people. So
I agree.
Other than the pain to switch again, is there any inhibitors or anything that would, any minimum time frame we'd have to stay with them
So
if we did switch?
Our notification to Broome Tioga has to happen by March 1st. So, and then Case BP said that they need 60 days. So that would, give us between, well, we would have May and June, they would need to switch over. So that gives us some time in between to start working on a switch over if we are allowed to do that, if we are going to do that. But I guess the big date is the notification to Broome Tioga. We have to meet that March 1st date. So one of the things, though, if we did, if we were able to, I know we've talked about it before, but it would help us in our outgoing years because of the money that we would get back, if assuming that fund balance was still there, and the consultant believed we would have a pretty hefty fund balance left over there. So that would help us, not next year, but the following year after we
Oh, it's a consortium, you mean?
Yeah, after we do the buy-in to Case BP, we still could stand to, net a couple $1 million, which I think would help us out and still have a good health plan. So it's,
Right. I guess what I was thinking is it's not likely that we'll have a zero the following year. So, say something better comes along or they become less attractive. Is there a minimum stay we have to be within this new plan?
That I don't know. The only thing that they mentioned is that our buy-in, which, what did I say that was? Was it like 1.6 million or something? You would only get half of that back. So, they would keep 50% of it. One of the things, though, with Case BP is that in our consortium, it's our own experience rating. It's based on Oneonta's experience rating. In the Case BP consortium, they don't do it by district. It's the whole group. So there's more, it's spread over everybody. So their rates tend to not be so drastic each year. The changes tend to not be as drastic. Then they could be. I mean, there's no guarantee.
Yeah, but that makes sense too, because you're buying in a consortium.
Exactly.
With the other plan, it's like we're buying our own insurance.
Exactly. It's more like a self-insured.
Yeah. So what, I guess tagging on to Jamie's comment there, what is their incentive to, after they get a bunch of schools in, to not jack the price up if we lose half our buy-in? If there's a penalty, what's their incentive to keep their rates low?
Well, it's the consortium it's our schools, it's our consortium. So, I guess it's us, running the KCP. Yeah, it's just school districts.
Okay.
And it's our BOCES. So it's our BOCES run plan. We're actually in the wrong BOCES plan, but we talked about that before because ours didn't offer the Excelis product and now they do. So we really do belong in Case BP, honestly.
Mhm.
But I think, it's our district making the decisions. Tom would go to the Board of Trustees meetings and have a say in the decisions of Case BP.
Okay.
So, but
And
I
I
guess
will,
I guess the other side of it is that based on our savings, we would really, everything else being the same, which it won't be, but if it was, we'd break even in year 2. So,
Right.
we're not locked into something whereby, we're locked in for 5 and then this is the best year we're ever gonna have. So I think there's not a huge downside to switching and probably an upside, and
Mhm,
certainly an upside year 1. So
right.
I certainly wouldn't be opposed to it.
The other component schools are very happy with Case BP
Mhm.
And the Medigap plan,
and the
that
Medigap
portion
plan.
of it too. So,
Yes, absolutely.
yeah, we asked around, no complaints.
So what's our meeting schedule in March, right? Because we'll have to make, oh no, in February.
February.
Yes. I don't have it right in front of
So,
me.
I mean, that's really where we have to put the union's feet to the fire.
February
Let us know.
24th.
Yeah.
Okay.
Oh, do we need to vote on it ourselves? Or is it just considered an operational matter?
That's a good question.
It is a good question. I think the board should probably go on record.
Yeah.
It's,
I thought we
we-
did last time.
Go ahead. I'm sorry.
Yeah, I thought we voted on it last time.
Yeah, I think we did as well.
we voted on,
The last time we switched, you mean?
Yeah.
Aye.
I'm pretty sure I was on the board when that happened.
Yeah, I remember when we went.
I think to join Case BP, you would have to have some kind of a signature documentation and board support for that. But we just need, I think probably it would be all done in conjunction with each other, but our first notification would be to Broome Tioga. So, I don't think it could ever hurt to have the board's seal of approval on either
Yeah.
step of that. So,
Yep.
but I will find out. I'm sure that there is some official legal paperwork. Okay. All right, I'm writing down these questions. All right, so I think right now we're just kind of in the waiting game, right? Waiting to hear back. And hopefully they'll ask questions because, when we're able to clarify, it's positive.
Absolutely.
Okay. All right. So that was good news if we can get that.
Yeah, that'd be great news.
Yeah.
Yeah.
Yeah. And the other thing that Tom and I had also discussed is even if this doesn't pan out, we may want to keep that retiree buyout on the table anyway, even if we don't get the switch, because that could take some of them off our plan.
Yeah.
It could, and there's definitely benefit to that because they have the coverage. So yeah, I definitely think we move forward with that.
And, having that age crowd, that probably doesn't help our experience rating.
True.
Well, the thing is, they have Medicare as primary right now, and that's kind of what the issue is with Broome Tioga, is that they have Medicare as primary, so they're actually not costing our plan as much, but Broome Tioga is charging us just as much as though they were primary and active, and that's really what's driving the costs up for those retirees. So they're getting all the premium for it, but they're not really having to do the payout.
Okay.
Right.
Yeah, that's true too.
Yeah.
That's really, I mean, for that group, that's not really a change if they're using Medicare already.
Right.
Exactly.
Yeah.
Yeah.
Okay.
Yeah. And then they would get the coverage, the additional coverage with the Medigap plan, so it can only be better.
Yeah.
Okay. So as far as the budget development goes, the salaries are in. We did get the updated cost from Broome Tioga BOCES. The benefits are in as we have them now with the Broome Tioga costs. And with the benefits in, our health is up 364,000, TRS is up 132,000. So right now and it's a work in progress. We're still working on this. It's very early in the budget stages. But right now we're up about $1 million, and you can see, half of that is benefits. So any savings we could get there is only going to help us.
When
So
you say the salaries are in, what do you mean?
well, I just put them in I put in all the people that we have now in our budget, and I did assumed 3%.
Contractual. Yep.
Okay,
It's assumed 3%. I mean, I don't know what that's going to end up being, but I put something just to have something in there. So, and I know that we're still working through that. The debt service numbers are all in. Special ed is in. I mean, that could change throughout the year. And then what I still need are the ONC BOCES costs, which I expect to get in early February. The building and department budgets, which are, that's not going to make a huge change in our budget unless they're looking for something big, or new people or new programs. I still need to meet with tech again. We met once, but again, we don't have all the costs that we need. So I need to meet with the tech department, which that one could fluctuate a little bit because we have added a lot of technology this year, just because of the situation that we're in. And I think a lot of it is good, so we're going to have to evaluate what we will still need and move forward with that.
What's
Buildings.
with ONC, BOCES, Lisa?
I just need their updated costs, the cost of their programs for 21, 22. And included in that will be our administrative, which, usually goes up a lot.
Do we
And
have kids that go over there to Norwich?
not to Norwich.
Yeah, not to Norwich.
No, Milford, Milford. But I'm looking for the updated cost for next year. So like the.
Oh, I'm sorry. I was thinking of the other BOCES, I guess. I'm sorry, because we were,
That's okay.
never mind.
it-
I was thinking of DCMO.
Yeah.
But Jamie,
No,
we have had students go to the Norwich campus. They have a couple of programs that Milford does not offer in terms of behavioral. So we have had students attend there before. So no, you were right on.
Yeah.
Well, no, I wasn't. Sorry. Thank you, Tom, but no, I had him backwards there for some reason. Probably because we were talking about the difference in the insurance there.
Yeah. Well, the ones that normally hit us the hardest are the admin budget and the OCSD, the CTE programs. So, we should get those numbers very soon, and we'll plug those in when we get them. Buildings and grounds, we did build in a truck. Their trucks are falling apart, and they're actually probably costing us more to repair than to just buy a new truck. There's 2 of them in the shop now, I think. The spring's broken, the 4-wheel drive is broken, different trucks, but so they just go get another one, and that one breaks too. So it's time. Brittany has also tried to check in with that SAMS grant just to see if, since the governor did his budget, if there's any change in that, which I don't think there is, but we're going to keep trying. We're going to keep bugging them about it. And we also need to think about summer school. There's nothing in there yet about summer school. And I know that there's some discussion about that. So that would be a new program. And we don't have the transportation CPI increase yet. So those are the big things that we're waiting on. And I looked at this would affect this year, but the retirement payouts. And so far with the people we know about, we're up to about $300,000. So with the officials. But that's normal every year. When people retire, we have those payouts. So that's.
But we have the breakage too.
Yes.
So
yeah.
Counteracting that. Yeah.
Yep. The following year. Yep. So that's where we are with the budget. I don't know if you have any questions about just the development process, but.
Do we have any positive variances that were, due to all the different things that we're having to do this year as a function of, I'm sure we have some negative ones too, but this budget's got to be different than any other one you've ever crafted, I got to believe, just because of the hybrid and all the back and forth and the testing and all those things. Are we saving anything considerable that we can look at, and what are we seeing for negative variances, I guess, that you've had to factor in?
So I think as far as savings, yeah, I mean, we talked about that a little bit at the retreat. We're going to have some pretty significant savings, some fund balance savings. We're going to have savings in transportation. We're going to have savings in just utilities, other areas. So we will see some savings. We've had, I think, some of the kids not going to programs at BOCES. We didn't have the summer school. We had it for the special ed, but not like we would normally have it. We didn't have, the LTAs there. So we are saving in areas like that. We had a couple LTAs in the budget that if we were all in person, we would have to hire more. And some of the, noon hour things are less. So we do have some savings there.
Including athletics as well right now.
Oh, right. Athletics, clubs.
Yep.
So we certainly do have some savings, but we are building the budget next year, assuming that we have a normal year again. So that's what we're hoping for.
But any savings we have could be offset if we don't get paid by the state, and then we'd be $1.5 million in Hull, right?
Absolutely.
Yes. So I'm actually looking, and I saw the BOCES came in, the BOCES, so that doesn't change our tax cap calculation by too much, it does a little bit, but I plugged the numbers in that I have right now. What I have been told, and I've asked a couple times, but is that our state building aid number is not correct. So I'm trying to get that number corrected. Other than that, everything else is in there. And I hate to say this, but I don't think our tax cap is even going to get to 1%. So it's pretty low. We're not even going to get to the 2%. And I think that a lot of the districts, you're going to hear that from.
Yeah. This was a topic of conversation on last Thursday's meeting.
Right now, without adjusting the building aid, well, I put in what is in the governor's proposal. We're at about 0.5%. And so it's not looking good as far as that goes. But once I have that number, which should be in the next day or two, I thought I'd have it by today, but I think fiscal advisors, everybody's calling them because they want the exact numbers for the tax cap. So I think they're pretty busy right now. But I don't be surprised if when we get our tax cap calculation complete, it's not going to hit 1%. And so, and 1% in our tax levy is $220,000. So right now, with just what I have in the budget as it stands right now, our tax is up 3.3%. Which doesn't sound like a high number, but when you have nothing to be able to put towards it, and you have to come up with $600,000 because that's the 3%. That's going to put a gap in there. So certainly the savings that we're getting now can help offset that. But again, we don't want to put that in as a revenue source and not be able to fill it the next year.
Right.
So it's just we have it, and we'll use what we have to, but it's just a dangerous game when you start putting a lot in there. Okay, so that's where we are with the tax cap calculation. I just wanted to let you know that I expect it's going to be around 0.5%, but we'll see once we get that number finalized.
Now, I'm looking through the budget run that you sent us.
Yes.
What is the pandemic adjustment for $431,000 or negative $431,000?
Let me pull that paper. And so we're looking at the same thing. It's on our run.
Yeah,
Yeah,
Okay.
it's a negative revenue source.
Oh, that was the current year we're in. That's the CARES funding. Remember, they took money away, but then they backfilled it with the federal funding with the exact same amount. So if you look down
Oh, yeah, yeah, yeah.
lower,
I see.
430. And by the way, we did finally get our CARES Act back in. You know, we had to revise it and put it back in because of the non-public schools. And so far, they've approved nobody's that I know of. So we haven't received that funding or approval for it yet.
so the CARES funding really didn't come to help us, it helped the state.
Correct.
Absolutely.
And
No,
that, and that, go ahead.
This was kind of off topic, but I was going to tell you, many districts have not even received their approval for their Smart Schools Bond Act yet. So,
They shouldn't expect it.
no, that was just an aside, but I was just sharing.
So,
That was 4 years ago,
yeah.
Yes. Yeah.
ish.
Yeah.
Mhm. Well, if you, I mean, let's take a look at that, the state aid proposal that, Bill, you were just referring to. And you see that there's, so what they've done, and I just sent you some of the, publications from ASBO, but what they've done is rolled a whole bunch of aids into one aid and called it services aid. The big pieces, so those are the categoricals, like the textbook, software, hardware, which are, they're not huge for us. But the big things rolled into there would be the transportation and the BOCES aid. And that could hurt a lot of districts. I actually think ours is overstated here, because I also sent you another page where it shows, if they were separated, what those aids would look like. And you can see that our transportation aid is very, very high, and that it's good, I guess, because if they take this aid and roll it into one, ours is based on a higher number, where some districts backed out their meals and things like that, and we did not. We just submitted all of our costs, regardless of why we had them for transportation. So I know the districts that did not submit some of the meal costs are, they're going to be hurting if they freeze this aid or they roll it into one, and then they make it, incremental increase or decrease each year. So
We had this last year too, right? You tried to roll them all up last year.
yeah,
and then-
Yeah.
he does it every year and it doesn't really fly, but we'll see. But there would be no incentive really to use BOCES either, because if you're not getting the BOCES aid, then sometimes it's more of a hassle, and it costs more sometimes, but then you say, okay, well, we're going to get the aid, even though it's not supposed to work that way. That's how it works. So it could hurt BOCES, and it could hurt transportation, because just say we switch transportation, later. We didn't do it last year, we did it next year. That wouldn't be rolled into there, the big increase. So, but you can see what the difference is. It goes from 689 to 1,067. I don't know where they're coming up with that number, actually. And that none of this takes into account our transportation glitch. This is just straight transportation, as though it was normal. So anyway, I really don't know where that number is coming from. So I think that service aid of 2.8 million is actually high once we get our actual numbers. The other thing is, if you look below that, they always include UPK in there. That's a separate grant. That's not part of our regular state aid. The public and private excess costs aid, I used the numbers that our stack person came up with because they're more accurate. These numbers are based on a few years back, and the state doesn't set the tuition rates, in a timely manner. So I plugged in those numbers. Building aid I'm checking on, but look down below, and nobody can really figure this out, but they put STAR in there like it's an aid to us. It's not. It's an assistance to individual taxpayers that they pay on your behalf to us. So nobody really knows why STAR is in there, except that maybe they're trying to get the money from the federal government and say that it's school aid. So I really don't know why that's in there. I don't know. Have you heard anything else about that, Tom? It's
You know, there's some theories out there. They're all just really, well, they're just theories. No one really knows. But many people are in agreement, just like you, Lisa. They think that, you know, maybe that this becomes something that the uh, federal government will take care of as though it's revenue, but it's very confusing and everyone's concerned about it, not really knowing where it's going. So
now, one of the things that I've heard that some of the districts are doing, and it's probably a good idea, we should probably do this, is to have people not take the STAR on their tax bill so that, you know, it's getting paid to us, and take it as the credit. You know, when you can sign up and you can get the STAR credit, because that way it's not showing up as our aid. And so in the future, if he says we're not paying, you know, this aid anymore and reduce the schools for some reason, you know, we just don't want it tied to school aid. So as many people as we can get to get the STAR credit, rather than, you know, having them pay the school and make it look like it's a state aid, that would probably be better for us in the future.
Also, you know, having it in there allows them to say, look, the percentage changes 3.84% for Oneonta. They're getting $700,000 more.
Yeah.
exactly.
And it has nothing to do with our school state aid. So it's a game he's playing, and nobody can really figure out what the point of putting STAR in there other than to get federal money and say it's a school aid. So, but that's really just, that's the state budget. That's not us. So if you look at the local district funding adjustment, that's the state aid that he's reducing us by. And then down below that, they're taking that COVID stimulus from the federal government and doing the same thing they did before with the CARES Act. So they're, you know, saving the state money, and instead of that enhancing the school aid, that money is just going to replace what they're taking away. So if we don't get the federal money again next year, how do we fill that gap with the aid that they're taking away? That's the problem.
Mm-hmm.
I'm doing that. So and also one of the things in one of those handouts, you'll see it. That is based on the bill that was passed in December. So I know that there's discussion about there's a $6 billion plan and there's a $15 billion plan. This does not include either one of those, but the talk is that if the $6 billion plan comes through, you know, from the federal government for the state, that he's going to pay for other programs. That's not going to help us at all in schools. But the 15 billion would help us. We would get more state aid.
So the SUNY budget, the analysis of the governor's proposal for the SUNY budget included the $6 billion and said, assuming, you know, we were all told to expect between a $300 and $400 million cut in aid. This budget only has a $59 million aid. It assumes a $6 billion stimulus from the federal government, and then just they basically refunded or funded everything that had not been funded, and brought it all back and brought it all whole. So they're getting the money. SUNY's getting the money, and the schools aren't.
Right.
But if you do get the $6 billion, then that means, you know, he's not going to cut this, I think. But the 15 billion would help us. 6 billion, another 6 billion is not going to help us. So that's, the other thing in the aid package is the prior year adjustments. Basically what he said is, we're just going to throw them away and forget about them. So if we owed you money from prior years, we're just going to forget about it. And we don't have that much, but we have $109,000. And if you read, you know, I read through the governor's, the narrative of it, and it basically says, well, it's because the schools didn't file things on time. And that's actually not the case. So what happens is, it's all these adjustments are basically building aid or excess cost aid. So if they don't set the tuition rates, which they don't for a few years, and you have adjustments based on, what they haven't done in a timely manner, then that's not our fault. We filed our stacks, but they didn't have the rate set. And then building aid, they go on estimates until you file your final cost report at the end of the project. That's the process. That's how you do it. So at the end of the project, when it's all reconciled, sometimes they owe you more. And it's not because it wasn't filed timely. It's because you can't file it until the project's done.
Right.
So those are those prior year adjustments that he's saying it's the school's fault, just forget about it. So
Was he
ours is,
the governor when you say he?
yes, that's
Yeah.
part of the state aid proposal, to forget
Yeah.
about anything they owed you from before.
He's looking to expunge any aid that is currently owed to us. Not
Well,
just
we
us,
have
all school.
Yeah, we have that as an accrued revenue though. So we're gonna have to make that adjustment if it's all of a sudden lost.
Well, I have to
Right.
tell you, a few years ago, because they take 10 years to pay it, so I record it. So it's on my trial balance, but I record it as an asset and a liability. I did not put it in as a revenue because, and I
Oh.
used to put it in as a revenue. So the remainder that's left has not been recorded as a revenue. So basically, I just take it off my books. So it won't hurt us, but they still owe us the money. They should pay us.
So when it does come in, you just count it as a unplanned revenue or something,
Right now I have it in deferred revenue.
deferred revenue.
Yeah, so I
Okay.
would take it out of deferred and put it in an actual revenue account. And I keep it there so that I can keep track of what they owe us, but I
Right.
don't want to record it as a revenue because they're not dependable. So,
That's about as accurate as you can say it.
Right on. So what's NISBA doing for us?
With the transportation aid?
No, with the budget, with the governor's
Oh.
proposal.
Well, they're always advocating. That's, what specifically they're advocating.
Yeah.
I guess to not have the services aid rolled into one, that's one of the things.
Yeah, it is. I mean, that's the gap elimination adjustment of old. Yeah. I mean, right? Isn't it where you take what the deficit is and divide it among all the school districts through a formula? I mean, that's
That's what they did.
That's the GEA.
Yeah.
And it was a decade, wasn't it, to get
Yeah,
rid of
but-
it?
Well, it was 2010, so pretty darn close to it. Too long.
So one of the other things that I heard in there too is, and I haven't seen anything official other than a little blurb in a newspaper that said that any of the adjustments that they made, the 20% withholdings, that they were going to give them, they were going to pay those by March 31st. But then I also heard that rather than doing the 20% reduction, temporary reduction, they were going to do a 5% permanent. I also heard that. So I don't know where we are with that, but I mean, I guess now we're looking at maybe worst case 5%.
Yeah, and I heard the same thing, Lisa, and I don't think there's been any update on that.
Yeah, there's been nothing official other than a verbal in a newspaper. So
Right.
we still don't know where that stands. And I need to see it, and I need to see the money in our account before I know what they're doing.
They're not dependable.
Yeah, they're not dependable. So a 5% permanent aid reduction just calculated on our aid this year would be 862, which is certainly better than 3 million. So none of it's good, but so I think that's where we are. As usual, we just really don't know yet what our revenue picture is going to look like, but we'll work with what we can right now, and we are plugging away at it. So the only other thing I had was the bus proposition, And I'm getting the cost for that right now, but what we are looking at is replacing 2 66 passenger buses, just basic replacements, nothing fancy. And then we've been doing the buses on the auction site, and they were doing really well for a while, and now they're not. So I'm gonna ask also for a trade-in value. If Matthews can give us a trade-in and see if that is more than we're currently seeing that we're getting at the auction. So, but the letter of intent, you'll probably see on the next agenda for the buses, which just basically says if the board approves it and the voters approve it, we'll buy them. If not, we're not getting them.
This is to finance them, right?
We will finance them again, yes.
Is there any danger, Lisa, of the aid on the buses being materially different than historic?
No, the aid on the buses well, yes, I mean, it's intact now. That has nothing to do with the transportation error. That won't affect that aid. But moving forward, if this aid is all rolled in together, then it certainly would have an effect because, we're buying buses and then you don't know if you're getting that capital aid back on them if there's no transportation aid. So, as our costs go up, we don't know what that aid would look like.
Huh.
So I guess in the future, if they keep the aid rolled up, which I don't think they will, that could affect us. But if it's still separate, then we're fine.
And we finance them for 5 years.
Yes.
Fine. Yep.
Yeah. And they pay us over 5 years. So I think that's all I had on the agenda. I don't know if you had anything else or any questions or anything
Well,
else.
what is our enrollment now?
Our total enrollment, it's, yeah, I can tell you, I'll tell you
I
right
mean,
now.
ballpark, Tom. I mean, I know it depends on the day, but
Roughly 1,600.
really?
Yeah.
So we did lose like 250 or something like that.
Yeah.
As due to homeschoolers or
Yeah.
other factors because of COVID, huh?
Christian school.
Yep. Yeah, I
So-
heard somebody just told me over the weekend, 150 kids down in Otsego.
Yeah. But I seem to think that when we, ultimately when we do go to 4 days a week, I think we'll see a lot of kids come back.
Mm-hmm. Okay. Thank you. I hadn't heard that number, and I was just again thinking about transportation and how many less kids we're picking up and that kind of thing too.
Yeah.
A normal year, we have a lot of flux. We got even more this year, I guess.
Mhm.
But what's interesting, we're still taking registrations. Even today, we had a couple new come in. Poor Rebecca, her office is basically in the parking lot. She runs out and meets folks out there, and
Really?
yeah. So
Are they new to the area, or are they from neighboring schools whereby our programming and things are maybe better than our neighbors? Is
it's
there
a
any
little,
rhyme or reason to it? A little both?
yeah, it is a little bit of both. Which is interesting because we, even in light of, the region's COVID numbers, we still have, so we've had kids who have transitioned from hybrid to remote, but we've also had families transition their children from remote to hybrid. It's been interesting.
Yeah. It's certainly a juggling act.
It is, our rolling 7-day average right now is still 5.5%, which is, concerning. And, speaking with Heidi today, today's positives, it's 19, which is encouraging. So hopefully we're going to, continue to see that number decline a little bit. Fingers crossed.
Yep.
Okay, so I guess if there's nothing else, then I guess meeting adjourned.
Well, thank you, Lisa.
All right, thanks.
All right,
Thanks.
drive
All right.
safe.
Have a
Take
good
care.
night. See you tomorrow.
Okay.
You got it.
All right, bye now.
Bye now. Bye.